My name is Wakgari Deressa from Addis Ababa University, School of Public Health in Ethiopia. I'm currently working on tobacco control capacity program with UK partners, and I am the coordinator of the project in Ethiopia. I'm the public health professional, and I have seen a lot of problems with regard to the public health, and especially with this program of tobacco control capacity program. Ethiopia has the largest population in the continent in Africa, next to Nigeria, which is about 108 million population, and about 45% of that population is young population who are actually exposed to tobacco and smoking in a different ways. So it's a wise decision to be involved in such kind of capacity building program to tackle this problem in the future among the future generation, the current and the future generation. Ethiopia is currently working on tobacco control in different ways through the government sector and non-governmental sectors. And one of the issues is making legislation about this to smoke-free environment or institutions. And it has been affected since last year. And the other one is increasing the tax on tobacco and tobacco products. That's again a promising issue. And the other one is to control about the tobacco industry interference, which is coming in a different way. For example, since the last 3-4 years, the Japan tobacco industry has bought the Ethiopia Tobacco Company, and for them that's a great investment, future investment, targeting the youngest population in Ethiopia in the next few years and so on. So because it is a strategic investment, and Ethiopia has a lot of young people, so they want to invest in that area, and Ethiopia should do the necessary interventions in order to prevent the interference of the industries, as well as to take necessary measures to address the tobacco smoking in general. We are expected to generate a lot of evidence, a lot of information, which is supported by research. We will generate what factors are really exposing the young people towards smoking, and also we are going to generate information on taxation pattern in Ethiopia. Taxation in Ethiopia is very low compared to other countries on tobacco, and recently there is a trend that since the last 10 years, the trend of increasing taxation on tobacco is increasing and increasing, but the effect of that taxation increase has not been studied. So we are going to see some information and generate for the government. The other one is we are going to research on the implementation of the tobacco industry interference issues in general, and about the awareness in the government officials, decision makers, and also what tactics are tobacco industry are using to expose the young people to their products and so on. So all this information come together, synthesized, and I think we will give the necessary information and evidence for the government to make the necessary policy planning and also strategies of preventing tobacco.